Morning. As winter comes our way, it carries with it traditions so many of us hold dear. These holidays are a time of reflection, joy, and family connection. As the holiday spirit arrives this year, it is tempered with the loss and anxiety caused by this pandemic, which has been with us most of the year and will be with us well into 2021. Vaccine distribution could begin by the end of this month, but it will not be widely available for several months. So we cannot let up on our efforts to stop the spread. We have to suspend our travel and avoid gatherings that could endanger the health of our loved ones. The pandemic is surging, and if we can get the universal compliance with pandemic protocols in place to protect us all, we can slow the spread and speed up our economic recovery. Last week, the Coronavirus Task Force put out a grim report on the state of the pandemic nationwide, as well as in Missouri. Here are some of the findings and recommendations from that White House report. Every county in Missouri has a moderate or high level of community transmission. 91% have high levels of transmission, considered red zone counties. St. Louis, St. Charles, and Jackson counties combined represent more than 1/3 of the cases statewide. The risk to all Americans is at a historic high. The national daily COVID incidence after Memorial Day, but before the summer surge, was fewer than 25,000 new cases a day. It's now more than 180,000 new cases a day. COVID inpatients back then were fewer than 30,000, but now are more than 90,000. Fatalities have more than doubled. We are in a very dangerous place due to the current extreme high COVID baseline and limited hospital capacity. A post-Thanksgiving surge will compromise COVID patient care as well as medical care overall. As the White House report stressed, it must be made clear that if you are over 65 or have significant health conditions, you should not enter any indoor public spaces where anyone is unmasked due to the immediate risk to your health. You should have groceries and medications delivered. Anyone who gathered beyond their immediate household during the Thanksgiving weekend should assume they became infected and get tested. If you are under 40, there is a good chance you will not develop symptoms. However, you are dangerous to others. If you're over 65 or have significant medical conditions and you gathered outside of your immediate household, you are at significant risk for serious COVID infection. All states and all counties must flatten the curve now in order to sustain the health systems for both COVID and non-COVID emergencies. The report highlights that the depth of viral spread across Missouri remains significant, and without public health protocols in place, compelling Missouri to act differently, the spread will remain unyielding with a significant impact on the healthcare system. Mitigation and messaging in Missouri need to be further strengthened, as other states have done. Effective practices to decrease transmission in public spaces include requiring masks and limiting indoor capacity in businesses until cases and test positivity decrease to the yellow zone. Strong mitigation efforts by neighboring states are showing an early impact. The White House report also stresses the importance of getting a flu shot to keep more people healthy and out of the hospitals this winter. The CDC on Friday provided its latest protocols. The agency stressed that indoor venues where distancing is not maintained and consistent use of face masks is not possible, such as restaurant indoor dining, are at particularly high risk. In St. Louis County, restaurants can provide outdoor dining, carryout, and delivery, but not indoor dining at this time. Transmission can also be reduced by promoting working from home, as well as reducing the size of gatherings, which St. Louis County currently restricts to 10. The CDC report also states that since the first confirmed case of COVID-19 was reported in the U.S. on January 20th, 2020, about 13.8 million cases and 272,525 deaths have been reported nationwide. On October 30th, the number of new cases reported in the U.S. in a single day exceeded 100,000 for the first time, and by December 2nd had reached a daily high nearing 200,000. In St. Louis County, more than 55,000 people have been diagnosed with COVID-19, and we have lost 1,098 of our residents to the virus. With colder weather, more time spent indoors, in the holiday season, about 50% of transmission is coming from those who do not have symptoms. and the U.S. has entered a phase of high-level transmission where a multi-pronged approach to implementing all evidence-based public health strategies is essential. These protocols from the CDC include universal mask use, maintaining social distance from others and limiting in-person contacts, avoiding non-essential indoor spaces and crowded outdoor spaces, postponing travel, and washing your hands frequently and thoroughly. These actions will provide a bridge to the future where there is a wide availability of vaccines, and that's when safe return to normal everyday activities will be possible. And I'd be glad to answer any questions.
So Dr. Page, we have a few from Channel 4 this morning regarding restaurants. City health officials said publicly last week the science does not support the targeting of one industry like restaurants, where they haven't been shown to be predominant sources of the spread. What is the county seeing in the science that the city is not?
Well, the county will continue to follow recommendations from the White House Task Force and the CDC. And I know that a statement was made by St. Louis City Health Board early in the week, but on Friday, the CDC reaffirmed and stated very clearly that indoor dining remains a high risk for transmission, especially in areas where the positivity rate is high, like it is here in Missouri and in St. Louis.
It's been 3 weeks since the ban on indoor dining was put in place. Do you think it is working, and are you satisfied with the decreasing cases the task force has reported?
Well, over the weekend, we do have a slight decrease in admissions and hospitalizations, a slight increase in ICU's capacities, or ICU stays. But we really have to watch for a trend, and what we've seen over the past couple of days isn't a trend. We'll know more by the end of the week. But we certainly hope that our mitigation strategies, our protocols, as recommended by our researchers and public health officials, will bend the curve and will lower the transmission rate in our community. And when we see that downward trend, we can start to consider backing off some of our public health restrictions.
Will you provide the health department data to the public that shows the mitigation tactic is working?
Yeah, whether or not our mitigation strategies and our public safety protocols are working will certainly be reflected in our website, stlcorona.com, which tracks on a daily basis, it's updated on a daily basis, the test positivity rate, the number of tests, the loss of life in our community. And another great source of information is the Pandemic Task Force reports on hospitalizations, hospital admission, and ICU capacity. And that's the data that we will be using in our public health department when our public health officials and our medical community makes recommendations on whether more restrictions are needed, or whether we can relax the restrictions that we currently have.
Does mid-December remain the end date for the ban of indoor dining? And is there a status update you can provide business owners to give them some idea of when they can reopen indoors?
Well, we hope that over the next week or so, we'll have more information on whether or not we can meet our target of mid-December for relaxing restrictions on indoor dining in St. Louis County. But we'll have to wait and see how this week goes and whether or not we're trending in the right direction. We know that these guidelines are important. We know that these protocols are recommended by the CDC and other public health experts, and that's why our Department of Public Health and our healthcare experts have made these recommendations and these guidelines.
That's all the questions we have.
Okay, thank you.